Okay, so in front of you, you should have Harry Potter's exam form. Most likely it's the re-exam form, um, or the new patient form is going to follow pretty closely along. But instead of clicking separate vitals and a separate exam form, just use the Dr. Busen exam form down here in the bottom left corner. So we'll start with there. It starts with neck index and back index. So if they don't have those, just end up erasing that from this part, but go through the motions and just click next. So we'll go through and put height in, weight, systolic, blood pressure, diastolic. This is pretty normal to how it always has been for you guys inputting vitals. That part really hasn't changed. It's just now all going to be in the exam form already. So now here it is. Kidney punch is negative bilaterally. Right light response marked as normal light, so we'll do within normal limits. And then pupils are equal at 4 and within normal limits. And then here we go into the ranges of motion. So what's the range of motion for cervical flexion? We have it as 50, cervical extension, lateral flexion of the left, lateral flexion of the right, rotation left, and rotation right. And then it'll prompt you next for now we're in lumbar flexion, as it says. And just continue inputting the information in. Lateral flexion left of the low back and right. Okay. And then here we start on the orthopedic exams. So foraminal compression circled as non-radicular, but it is mechanically blocked at C4. So non-radicular is selected, and so was mechanically restricted. And then just go ahead and type at C4. Cervical distraction relieves symptoms. So should be relieve symptoms here. Decrease symptoms. Shoulder depression left is negative, and right is also negative. Kemp's test, see it does jump around a little bit here, is also negative. Straight leg raise, negative bilateral. Oh, sorry. Sitting straight leg raise, negative bilaterally. Left straight leg raise degrees, 90. And right is 90. Brackets on here says negative bilaterally. Milgram's on here says negative. Yeoman's is listed as negative bilaterally. So you can select negative bilaterally, or you could do left and right negative. Eli's is negative bilaterally. Knocklis is positive on the left, but negative on the right. So left positive, right negative. Hibbs test is left positive, right negative. So left positive, right negative. Patrick's or Patrick-Faber's is left negative and right positive. If sensory wasn't done, you can just skip this one. This is going to be labeled light touch sharp dull. I know that there's a little mistake there. And if vibration wasn't done, you can also skip that and just make sure you erase it from the end. When it comes to DTRs and the muscle testing of the myotomes, they're automatically, as you can see, going to put in what's normal. 5s out of 5, and then go ahead and just change the ones that aren't abnormal. So just like that. Deltoid is 4 bilaterally, so just click and change it. All the rest are 5s except for peroneus longus, so go down here at the bottom and also put in 4s and another 4. If you look at the DTRs right here, we have biceps are actually 3s, so whereas 2 is average normal, we just reselect just the ones that are different if they're different than what would normally be put. And then you're all set. So we just want to scroll through and make sure that we have everything has a number. There's no others listed at all, and everything kind of makes sense. So we didn't have any of the sensory things, light, touch, sharp, dull, or vibration. So we just take that out, just like that. Motor stays there, and so you can see you have your 4 to 5s for the deltoid and peroneus longus. And here you have your 3s for biceps, whereas everything else is 2s. Next, we're going to move on just to the assessment area. So nothing much has changed in this picture. To put in your current diagnosis, to click current DX, and then he's a new patient in corrective phase of care, so we want to add that as well. And that is all.